Hi, I'm Dr. Jensen of Cedar Park Premier Dentistry. Let's talk a little bit about crowns. A crown is basically a restoration that covers the entire tooth. You've heard the term cap before. Basically, a cap is a crown. It covers and caps the tooth and pulls it back together, strengthening the tooth and the restoration. Crowns can be made of gold. They can be made of metal with porcelain bonded to it. They can be made of all porcelain, and they can also be made of zirconia. Our favorite type of crown here at Cedar Park Premier Dentistry is zirconia. Zirconia is the latest, greatest material that's aesthetic, beautiful, but very, very strong. The reasons for needing crowns can vary. Crowns are needed if a tooth has a very large existing filling in place. Crowns are also needed if part of a tooth is broken. Also, if a tooth has had a previous root canal done, it also should be crowned. The drawbacks for the most part are simply that you have to go through the process of getting it done. The benefits to having a crown are as follows. A, it is aesthetic. It always looks better to have a tooth in place than to not have a tooth in place. B, health-wise, it's better to have that area covered up than to have it exposed. And lastly, you are restored to function by having a crown and you're able to fully chew and function on the tooth. The process for having a crown done is relatively simple. It's merely 2 visits. The first visit is to fix the reason that you needed to have a crown done to begin with, to get rid of the decay, to get rid of the big old large filling, to get rid of the fracture. And then of course we take an impression of that area and then we make a temporary crown for you to leave with that day. The second visit, which comes 2 weeks later, is the final visit, and that's the exciting part. You actually get the crown cemented into place and you are done. Again, I'm Dr. Jensen of Cedar Park Premier Dentistry. I hope this information about crowns has been helpful to you.